To walk us through these developments, let's talk to a public health consultant, Dr. Nseabasi Ekanem. He joins us live via Skype from Lagos. Good to have you join us, Dr. Ekanem.
Thank you very much for having me.
So how do you read this latest development in terms of the back and forth? Over the weekend, there were reports that Nigerians who have been vaccinated were being discriminated against in terms of entry into the UK, that we were being placed on the red list, and they still have to isolate for some days. But now the Nigerian government has said Nigeria is not on the red list because of the AstraZeneca vaccine and the Moderna vaccines. But should any country even be on a red list because of vaccines?
Well, the truth is that I have gone through the documents and the publications, and I would say that yes, the UK government is applying stringent measures to ensure that the United Kingdom territory is protected from newer strains of COVID-19. Well, the fact that Nigerians, not just Nigerians, but other travelers across the world, for certain countries where the level of vaccination, the extent of vaccination is far below average. For example, Nigeria, the fact that they have to be quarantined for 14 days before they can have access to areas in the UK is, for me, is just a precautionary measure. And like the Dr. Fesai said, it's not because Nigeria is under the red list. Yes, there has been some simplification so that people can belong to either the red or the green list, with the red list being under caution. But I think that that is not to say that the UK government have issues with the vaccines. After all, the AstraZeneca vaccine is coming from the United Kingdom, and they are the ones that supplied it to us. So they don't have issues with that. I rather think that what the issues they have is the fact that in Nigeria and many other countries like Jordan that have been mentioned, the level of vaccination is still not as high as it is in the UK, and the chances of newer strains of COVID-19 virus developing in these countries is much higher, compared to the UK. So that's where the caution comes in. Not really that they are not satisfied with the kind of vaccines and the rollout of vaccines in Nigeria.
But we also know that there are some vaccines that are of concern to the WHO and just the international community. For example, the Sputnik 5 of Russia is still a vaccine of concern. It has not received any form of approval. Yet here in the country, NAFDAC has said it has carried out some level of test, and they've certified it okay for Nigerians, for use for Nigerians. If Nigerians were to take the Sputnik 5, would that not generate some sort of reaction, some sort of discrimination in terms of when you go to other countries like the UK and then they say, oh, I took the Sputnik 5, wouldn't that be a challenge?
It will be a real challenge, and that's why the Nigerian government, the Nigerian Ministry of Health, must stick to the WHO pre-qualified, or rather the vaccines that has been given that emergency use approval by the World Health Organization. Because, well, like you rightly said, there are some vaccines that, in terms of efficacy, they are not really good enough. And in terms of the safety profile, they are also not good enough. For example, that Sputnik vaccine, for me, it is not as good as the other ones that we have. But good enough, Nigeria has benefited from AstraZeneca vaccine, which is good by all ramifications. Now we are having the Moderna vaccines rolled out in Nigeria, which of course it has over 94%, 94.1% efficacy. So for me, I believe that Nigeria has toed the line of the safe vaccines and the efficacious vaccines so far. So we should try as much as possible not to roll out those vaccines that are still questionable by World Health Organization standard, because that may reinforce some of the issues that we are noticing now in the UK in terms of discrimination of inbound passengers. So it is important that we stick to the ones that we have and only approve vaccine based on WHO's recommendation.
Just a lot of issues to look at. Hopefully we'll have you again to look at these issues with people who now, the racketeering within the medical sector of vaccine cards. I would love to have you again to look at that. Thank you, but I am out of time. Thank you so much for talking to us, Dr. Nseabasi Ekanem.